Hi friends, today we'll deal with 5 questions from pediatric nursing. The first question is, a 9-week-old infant with congenital heart disease is being discharged. What is the most important advice a nurse could give regarding feeding? These are the 4 options. The correct answer is option 4. Provide a high-calorie formula or fortified breast milk. The reason is, for infants with congenital heart disease, they'll have difficulty in feeding and gaining weight, and they tire quickly during feeding. It's also advised to give small and frequent feeds. It's always better to keep the feeding time to around 20 minutes per feed. Now the next question is, which is the most appropriate method to use when drawing blood from a child with hemophilia? These are the 4 options. And the correct answer is option 4. Schedule all labs to be drawn at one time. The rationale is, by coordinating labs, it will reduce trauma and the risk of bleeding. Platelets are typically normal in hemophilia, and heat would increase vasodilation and increase bleeding. Finger sticks are more painful and they might induce more bleeding. Before moving on to the next question, we'll just look what hemophilia is. Hemophilia is an inherited bleeding disorder in which a person lacks or has low levels of certain proteins called clotting factors. And because of these low levels of clotting factors, the blood doesn't clot properly, and as a result, it can lead to excessive bleeding. Now moving on to the next question. In a child receiving cyclophosphamide for leukemia, what adverse effect should the nurse assess? The options are, these are the 4 options. And the correct answer is option 1, cystitis. Cystitis is a potential adverse effect of cyclophosphamide, so the client should be monitored for pain on urination. The other options like photosensitivity, ataxia, and cardiac arrhythmias are not adverse effects associated with cyclophosphamide. As you all know, cystitis is the inflammation of the urinary bladder. Now the next question. Which initial physical finding indicates development of carditis in a child with rheumatic fever? The options are, the correct option is option 4, heart murmur. As you all know, the most common signs of carditis are heart murmurs, tachycardia during rest, cardiac enlargement, and changes in electrical conductivity of the heart. The other options like hypotension or chest pain are usually not signs of carditis. The client might have rapid pulse, but it's not usually irregular. Moving on to the next question. Which pain medication is contraindicated in client with leukemia? The options are, the correct answer is option 2, Ibuprofen. The reason is, Ibuprofen prolongs bleeding time. Non-narcotic drugs other than Ibuprofen or aspirin, such as acetaminophen is used in combination with codeine or hydrocodone if the pain is more severe. Hydromorphone may also be used for severe pain. So the correct answer is Brufen. Thank you for watching the video. See you soon with another 5 questions. Do share it with your friends if you find it useful.